Everyone, so good to see you today. I'm here with Tara, one of our amazing massage therapists, and we are talking about contrast therapy, ice and heat therapy together. So before we get started, you can go to modomamassage.com to get started with your introductory massage package. We would love to help you in any way that we can. And Tara is going to be talking to us today about how we can use ice and heat therapy when we have an injury, when we have aches and pains. So do you just want to go right into it? When's a good time to use ice and heat therapy?
So ice and heat kind of goes hand in hand. So ice, when you have a sore muscle, icing it can help reduce the swelling. If it's something that you pulled or maybe kind of an injury type thing, working out, you tripped over something, ice is the first thing to start with. If it is a pretty bad one, pretty painful, use ice. You would apply it for about 10 to 15 minutes, remove the ice, let the body come back to the warmer, the normal temperature in that one spot, and then apply the ice again. And as I said, if it's a pretty bad injury, you don't want to apply heat until 72 hours past that injury.
Okay. So what do you say is like just a rule of thumb, good time period, like for ice and then heat?
So again, if you are, so you overwork something and you want to make it heal more quickly, you're going to use ice first. That pushes everything out of the veins. And then you probably want to use it for about 15 minutes at the very most. Okay. And then you would apply the heat. So the heat will draw everything back into the area. It'll rush back in with the blood and all of the healing properties of that.
Okay. So you don't have to go into like the technicalities of how it helps migraines, but just because I thought it was so interesting because she was saying you were talking about how you could put ice up by your head and then heat down by your feet, and in some scientific way it works. So would you just tell us how to do that? So you guys suffering out there with headaches and migraines, listen up, because this is really going to help you.
So if you can get a cold pack, ice in a Ziploc bag, whatever works for you, but make sure that it's not the ice bag right on the skin. You want to put a towel around it. So you're going to put that on the back of your neck.
Okay.
So you want to do that for maybe 10, 15 minutes. And then you remove that. But at the same time, you're going to be put heat on your feet. So that draws the blood closer to your feet, removing much of it from in this area.
Okay.
So it kind of gives you a little more relief. Yeah. Even something as simple as a cold soda can, just lay back and put your neck on that cold soda can and try to relax and get some of the pain to diminish and the swelling from the migraine.
That's great. That's really interesting. So would ice and heat therapy, would that be used for things like arthritis, bursitis, different things that are kind of ongoing? Because I think you said don't do it after 72 hours.
Right. You don't want to apply heat until it has been 72 hours past an injury.
Okay.
So
for like an ongoing joint problem, can you use ice and heat, or do you just want to use ice?
If it's arthritis and something in that realm, you want to use ice.
Okay.
Heat can also bring more inflammation. So the ice is the important part with this.
Okay. Okay, great. Let's see. Is there any time that contrast therapy is not helpful?
Again, if it's a recent injury, you don't want to use heat. You want to use ice. But remember, only apply it for 10 to 15 minutes. Take it off. Let it come back to the normal temperature of your body, and then reapply it.
Awesome. Thank you so much. I really appreciate you being here. You guys can go to modomamassage.com to learn more about what Modoma has to offer. We're offering an introductory massage package right now. Thank you so much for tuning in. You guys are wonderful, and we'll see you next time.
Thank you.